Hello everyone, I will be presenting on exposure therapy in the context of play for children with anxiety. These are my two questions, so keep them in mind as you listen to my presentation. Let's talk about what is anxiety. Anxiety is a disorder that is characterized by pervasive and persistent feelings of uneasiness, fearfulness, or dread that are not founded on realistic concerns. In order to be diagnosed with anxiety, these feelings must persist longer than 6 months. According to the CDC, 7.1% of children aged 3 to 17 years, approximately 4.4 million, have been diagnosed with anxiety, resulting from various reasons such as inborn genetic traits and environmental factors. Anxiety, how it affects children. Subclinical levels of anxiety may also have a negative impact on children's occupational performance and social participation. Children who suffer from anxiety restrict exploration and avoid novelty. These children are characterized as withdrawn, many cling to their parents, are timid, and emotionally restrained from exposed to unfamiliar situations. Anxious children display behavioral reactions such as crying, resisting an activity, having a tantrum, feeling of withdrawal. When the child is presented with spontaneous or unstructured situations, they tend to be over-rigid, over-controlling, and lack playfulness. When the child or the children do not outgrow the fear and worries that are typical in young children, or when there's so many fears and worries that interfere with school, home, and play activities, a child may be diagnosed with an anxiety disorder. So here are some different types of anxiety disorders, such as being afraid when away from parents, it's just separation anxiety, having extreme fear about specific things or situations such as dogs, sometimes cats, insects, or going to the doctor, which is a phobia. Being afraid of school and other places where there's a lot of people would be social anxiety. Being very worried about the future and about bad things happening can be general anxiety, which some kids are kind of like going through right now with this whole COVID-19 situation or pandemic. Having repeated episodes of sudden, unexpected, intense fear that come with symptoms like heart pounding, having trouble breathing, feeling dizzy, shaky, or sweaty, which are panic disorders. Anxiety may present as fear or worry, but can also make children irritable and angry. Anxiety symptoms can also include trouble sleeping, as well as physical symptoms like fatigue, headaches, or stomach aches. Some anxious children keep their worries to themselves, thus the symptoms can be missed. So it's really important for us to have really good communication with our children, whether you have children of your own or you are a practitioner treating children. Keeping that good rapport so you can find out what's going on with them to help them. Let's talk about exposure therapy. So gradual exposure is the core of CBT. Gradual exposure has been shown to be an effective technique to treat pediatric anxiety. The process of gradual, continuous, repeated exposure to anxiety-provoking situations or objects lead to decline in anxiety levels. The therapist, along with the parent, the child, they can work in conjunction to identify situations or actions that the child is avoiding as a result of their anxiety. Then the child is engaged in those particular situations and repeatedly in order to stabilize that progress. So it's gradual exposure. It is said that within a single exposure between exposures, a decrease in anxiety can be observed. And I have seen that myself in children. Play therapy. Incorporating play therapy can enhance motivation, accelerate change, and can promote internal changes. Play is used to help children deal with emotional and behavioral issues. When children feel secure and are in an emotionally supportive environment, the child is able to play out their thoughts and feelings. Play serves as a child's symbolic words, which the therapist then can reflect back to the child to achieve greater understanding. Play affords the child a strong sense of self-efficacy and a sense of achievement. exposure, and play therapy. The inclusion of exposures within play therapy may prevent the therapist from missing an important aspect of the child's life. The therapist can design the exposure task as play or create a playful atmosphere during the exposure. The playful atmosphere during an exposure task will distract the child from his or her anxiety instead of focusing on it. So here I have an example of David. David is a 4-year-old with selective mutism, did not speak with unfamiliar adults or even with his highly familiar teacher. Previous attempts to encourage him to say a word or two never elicited his cooperation. His parents described him as a child who never takes the risk of making mistakes. During the first few sessions, David was frozen, sat in one place, did not play, did not want to talk. The therapist suggested that David and his mother should play the Grapevine telephone game. I'm not sure if you guys remember. This is a really old game. But it's really fun. For the first round, the therapist asked everyone to whisper so his level of anxiety remained low. As the game progressed, the mother began to make mistakes and say funny words to make each other laugh. Then the game became spontaneous with no need to whisper. At that point, David was having a great time, and you were able to hear his voice loud and clear. The Grapevine game served as a transitional object for David in real life. In the end, the game was no longer needed as David's speech in school became free and spontaneous. Example of playfulness and exposure. David's examples show that the therapist's playful stance and inclusion in play can enhance a child's engagement and rapport during exposure. Similar procedures can be found in studies describing ways to adapt CBT to young children. A good example is Coping Cat Program, a treatment manual for children and adolescents with anxiety disorders that use playful elements within traditional CBT modules, examples psychoeducation, emotional awareness, and exposure therapy. Additional examples to teach children relaxation techniques. They are asked to pretend they're robots or a strand of spaghetti to help them realize the difference between being really tense and then being relaxed. These are my references. Thank you so much for listening, and I hope you liked it.